Yeah, doctors say he's been diagnosed with bipolar 2 disorder. Doctors at the Mayo Clinic describe the disorder as a combination of depressive and manic episodes. In Jackson's case, doctors say his bipolar 2 diagnosis means that his manic episodes aren't as extreme and they can be treated. Here to talk about more about the working with the bipolar disorders, Dr. Sheela Raja, a psychologist at UIC. So the 2 indicates the severity, in this case, not as severe.
Right, exactly. It still means that he suffers from periods of depression, and, you know, we don't know what those episodes of the more manic episodes look like. You know, usually for people, they involve, you know, decreased need for sleep, feeling like your thoughts are racing, maybe being impulsive in some ways, but, you know, and they take a toll on your relationships. You probably don't take care of your health very well when you're in those manic stages.
So, Dr. Raja, with somebody who has this condition, what would it be like for them to go to work, and how hard is it going to be for him to come back to work when he starts to have episodes?
Well, you know, he's really lucky. He got treatment at the best place. You know, the Mayo Clinic is a fantastic place to get treatment for mental health, and so not all Americans have access to that kind of care. And so I think that he's going to do really well with the combination of medication and the social support that he seems to have.
What happens there inside the walls of the Mayo Clinic?
Well, I mean, probably that they work with him. They work with him on finding the right medications for him. They work with him on talking about stressors and how to recognize when some things are building up for him. So it's probably a very individualized treatment. So that's a great thing.
So the goal of the treatment, is it to stop the episodes or to help him control himself when he experiences them?
Well, it depends on the severity of what he's experiencing. But, you know, a lot of times when people have mood disorders, it's so that they can recognize the signs and be able to manage them better. So it is a biological condition.
So it can be diagnosed from chemicals, something, is it
well,
blood
we know it changes brain chemistry. We're not at the point of blood tests at this point.
It's very interesting.
No doubt. Dr. Sheela Raja, thank you.
Thank you.
It is 6:26.